reoccurring revenue. Just a bit of the details on the pay raise. It's a 2-year plan to increase starting pay from $37,000 to $40,000, and then immediately you start the step increases at year 1. And currently there are no step increases from 0 to 3 years. So to start our step raises at $500, except for at the 5-year increments of 5, 10, 15, and 20 years, where it is, if you're Class A, it's $1,325, 2A, $1,425, 3A, $1,525, and 4A, a $1,625 step increase. We've also included at the 25-year point, that $2,500 bonus. That has remained the same. And so ultimately this averages out to be an increase of approximately $4,800 for average for all of the teachers. Like I said, it may change depending on the experience and the classification school level you're in, but it averages out to about 47. So if you include that with last year's $1,000 raise, that's $5,800 for our teachers that this committee, as well as the full Senate, would hopefully approve this year. The reason it's a committee sub is because we've also included language beginning on line 160, which removes the cap for our school nurses and the athletic trainers. If you remember last year, we passed this bill, but it was signed before the teacher pay raise bill, and so therefore, because the teacher pay raise bill was signed last, that cap or that law did not become effective. And so this allows those professionals to receive up to a $6,000 supplement. It's an appropriation that's made at the end of the session in the education budget. It will not be, if you recall from last year, it will not be a cost any money because we appropriated in the budget, and for the last several years we have not reached the cap. So this just removes the cap, allows more people to have access to it. And so with that, Mr. Chairman, I'll yield for any questions if there are any.
Senator DeBar, could you explain to the committee some of the rationale behind the specific changes as it relates to the teachers that are the different levels of experience, and what your attempt to do and the committee's attempt to do is to recognize some of the areas where we saw that we were weak and where we were strong in Mississippi on teacher pay? Well,
thank you, Mr. Chairman. What we've heard from SREB, the Southern Regional Educational Board, as well as teachers, was there was very little incentive to stay a teacher when you're a brand new teacher and you're coming out of college and trying to support a family, pay the mortgage, buy a car, things of that nature. And SREB recognized and provided data that showed that we lose a significant amount of teachers within 5 years. And so they recommended that we right-size the salary schedule more towards front-loading the salary schedule, because what they had informed the Education Committee and us was that if we front-loaded the schedule, it would allow us to retain and recruit more teachers. The data showed that teachers from 25 years and above, we were in the top 5 of the Southeastern average as far as pay. But teachers below that, we were near the bottom. And so what they recommended is we try to right-size the salary schedule, provide more front-loading, mid-year, mid-career raises, and that's why you have the $500 step increases as well as the big bumps at the 5-year increments. The teachers have told us that they would like to see those 5-year bumps because that would provide them some incentive to stay rather than leave and go to Alabama, Tennessee, Louisiana, where they might make more money. And so this, we would like to see a higher starting pay, but if you take the money that was available, and right-sizing the schedule, this will allow us, I think, to attract and retain more teachers in Mississippi.
Thank you, Senator DeBar. Are there questions of the committee members? Senator Butler, you're recognized.
Thank you, Mr. Chairman. Is it on?
It's on.
Okay. Mr. Chairman, did you say that the nurses will be receiving raises?
But we're removing the cap on the $6,000 supplement that they will also they'll be available to them. And so we passed it last year, but it was signed before the teacher pay raise bill, so it did not go into effect. Yes.
Do you know when the last time they got a raise?
I do not recall.
That would be for all nurses in our schools.
It just allows them to get the extra $6,000 supplement, yes.
Thank you.
Thank you, Senator Butler. Senator Norwood.
Thank you, Mr. Chairman. Chairman DeBar, included, do we have the teachers' assistants included?
No, Senator Norwood. We wanted to focus on raising the teacher pay and as well as provide some type of incentive for teacher assistants to become teachers. We need teachers, and I'm not trying to demean what teacher assistants do. They do great work, but we need more teachers. And so if we can raise the salary, provide them some incentive, do the things that we passed last year, the Winter Read loan repayment program, maybe we can get more teachers in the classroom. And there's nothing that prevents the local district from providing any supplement as teacher assistance as well. So we wanted to focus on spending all our money on teachers. Not that that won't be in the final version of the bill, because we all know this probably will go to conference. But at this point in time, we just wanted to focus on teachers at this point.
Thank you, Mr. Chairman.
Thank you, Senator Norwood. Senator Suber, oh, that's your question? Okay. Any questions, Senator Turner Ford?
Thank you, Mr. Chairman. Senator DeBar, how will this, let's just say, provided that other states do not change their salary structure, as it relates to the minimum or the base pay for teachers, where would that put us in reference to how other states pay in the Southeastern?
It's really hard to say just on base pay, because when the Department of Education provides their average salary, they include the local supplements and the board certifications. They're running those numbers for us now. I hope to have them as soon as possible to provide you that information, because I think it's important. Obviously, this amount of money and this amount of investment is significant. It's going to raise it as long as other states don't raise theirs, which, as you know, other states are facing a teacher shortage as well. So they're going to be, I imagine, doing what they can do to raise their pay to incentivize them as well.
And I have one last question. During the hearings that you all had, I think one of the issues that was mentioned was insurance. So are there any efforts to look at the premiums that teachers are paying, maybe on another committee or another bill?
That was raised, obviously, if you recall, and I've spoken with our chairman. I think there might be something coming out, and I think Senator Hobson probably could speak to that, or Senator Polk. I think it's going to be a 6% increase in premiums this coming year, I believe, is what I've been told. So hopefully there'll be something there, but at least this raise will cover that insurance increase.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator Turner Ford. And Senator, we are currently looking at the state health insurance issue, and obviously there's been an increase there in the last year or so, and that's something we're keenly aware of to try to help keep the costs down on any health insurance raises. So it will be something that we continue to look at as we progress through this session, and we may get to a point where we're looking at that as well. So thank you. Are there other questions for Senator DeBar? If not, do I have a motion?
Title sufficient, due pass, committee sub.
The motion is title sufficient, due pass, committee sub. All in favor say aye.
Aye.
Opposed, nay. The ayes have it. That bill will be reported. Next, we'll move to Senate Bill 2862, and as I mentioned, Senator Polk will give you an overview of some of the work that his ad hoc committee, the subcommittee, did on this. And just as he will, let me explain this in case he doesn't. The bills, you've got 4 bills in front of you. He's going to give you an overview of the entire discussion that the subcommittees had on the ARPA funds. But these are 4 appropriations bills that we're going to go over. There are some general bills that will cover the topics of which he will discuss briefly, and there will be an opportunity at some point when those bills make it out of their substantive committees to get back to us, and all of it will have to come back to the Appropriations Committee at one point if it involves spending funds. So he's going to give you an overview of the whole project, and then we're going to break down these 4 bills, and we'll open them up for questions at that time. So Senator Polk, you're recognized.
Thank you, Mr. Chairman. Many times when someone has been given the task that our subcommittee was given, they start out by saying, y'all, we worked really, really hard. I don't know that I'm going to tell you that. What I will say is we worked really, really hard to come up with the plan that you'll be seeing today. One of the handicaps that we had in the beginning and until about 2 weeks ago was that we were dealing with the Treasury Department's interim final rule. Now, I don't know how you have an interim final rule, but we did. And we were operating out of that, and it would change day to day, hour to hour. Finally, 2 weeks ago, we got the final rule, which helped a lot. And what we found was the things we are proposing will fall into the acceptability of the Treasury rules. How did we get here? First, we had 5 days of public hearings where we heard from many, many, many agencies and organizations requesting funds and telling us how they best could spend the money that we had to spend. After that, we started meeting deliberately and carefully deciding how we're going to dispense these funds. We had $1.8 billion to spend. And in anybody's mind, you would think that was plenty. But we had $8.3 billion in request. The first thing we thought we should do is to move as many funds as we could, as many dollars as we could, to our general fund. And that could be done by the rule of lost revenue. LBO did a great job. They came up and worked with DFA and DOR and followed a formula that was given to us by the Treasury Department of how do you determine what lost revenue is. It turns out it was around $286 to $290 million. We decided as a committee that we would move recommend that we move $250 million of those dollars. That gives us a little cushion, so if we've made an error here or there, I don't think we did, but if we did, then we have a way to not have to claw back to the federal government funds. The reason we wanted to move so much to the general fund is this. When you can move the money to the general fund, most restrictions came off of how you could spend it. For instance, roads and bridges cannot be covered under ARPA funds, but if moved to the general fund, that is a possibility. There are 2 or 3 things that we still can't spend ARPA funds on. We still can't give a tax relief or credit because of the ARPA funds. We can't pay off debt with the ARPA funds. But there are so many more things we can do, and it gives the legislature the ability to work better and provide for our people better. Another consideration we had to look at is all funds have to be allocated by December 31st, 2024. All funds have to be expended by December 31st, 2026. That, ladies and gentlemen, is a short timeline. And for many of the projects that we heard from, there would be no way those could be concluded and paid for in that timeline. Will the federal government give us extra time? We don't know. They could, they possibly will, but we can't go under that assumption. So the assumptions we used were the dates that I just gave you. Our spending also had to focus on a rule the Treasury gave us, which was you could spend funds that were incurred March 3rd, 2021 forward. In other words, you can spend funds next year or 2, but you can't spend them prior except in very defined areas before March 3rd. When we started looking at how much money we had to allocate and recommend that this body do, we had $1.8 billion minus the $250 million that we're moving to the general fund, which led us to have $1.55 billion left. First of that, we wanted to make sure that there was some held back for future purposes as things arise in the next year or two. So we created a holding account that we will be moving funds to, and in just a minute, we'll be talking about that. Of the projects we were asked to fund, 99% were good, legitimate, worthy projects that would have helped Mississippi. Our subcommittee had to decide how do you spread 1.55 across 8.3 billion in request to do the most good for Mississippi. We started, and after we had allocated those funds, we started a priority list. We determined as a subcommittee, and spent several hours determining what the priority of our recommendations should be. And we came up with 10 groupings that you will see here in just a minute on your a paper that you have in your hand. Those priorities, along with our task that the Lieutenant Governor asked us to do, was to make sure that we made transformative difference in Mississippi, not just today, but in the future to come. I've said this laughingly. I had a meeting with him, and one time in that meeting, he said, I want projects that you and I won't see the end of. They won't be concluded. The useful life of what we do won't be ended by the time we get there. Well, I don't know about...
Will that be next year?
For me, possibly. For this gentleman back here, as good a health as he's in, he may see the end of these projects. But we had a lot of good interaction among our committee. The hardest part was setting the priorities. We never got angry at each other, but I can assure you we had very good conversations. Many things were vetted, and in the end, we had a plan that we feel like we can present to you, which is what you're seeing today. So I believe you do have in front of you our recommendation. So if you'll look at that, our first priority, and the first priority of the Lieutenant Governor, is to improve the infrastructure of water and sewer in Mississippi. Every one of us sitting at these tables know that some area of the district we represent has a need. These are the transformative projects that can go for 25 years and help communities solve their problems. What we did there, it was such a high priority, you'll see that we have $750 million of the $1.55 billion allotted. Cities and counties, $350 million. Rural Waters Association, $350 million. And $50 million for communities who received less than $1 million will be able to get a larger match than those who received more than $1 million. Because most of the projects that we'll be looking at will have a higher cost than we'll be able to match, and they'll be able to have of ARPA funds. And we'll be matching ARPA funds only. So if they come up with other funds to finish the project, that's what we need them to do. But we'll, as a state, will be matching ARPA funds. Secondly, we thought job training and workforce was imperative. You'll see that we're putting $55 million to job training and workforce. This primarily is for healthcare workers. Nurses, I guess, would be the first priority. Other allied health professionals would be in the mix. We feel like the best way to solve our nursing shortage, our medical personnel shortage, is to increase the supply. And our community colleges and other institutions are ready and willing to do that. We've just got to give them the funding to see that that happens. We'll be seeing significant increases in different health professional services. We hope many of those will be going to underserved areas, but that's the plan, and we'll be looking at that in bills later. The next allocation is $59,100,000 for child protection services. We all know that during this pandemic, many, many children have caught the side of a parent sometimes or a family member that's not the best. And our child protection services have been worked hard. We feel like letting them spend funds that will be able to protect our children was imperative. What we want to do is to reach a point to where, as you all know, federal courts have been involved in Mississippi's child protection services for years. We're told that with these funds being spent, we will be closer to getting our child protective services to a point to where Mississippians will be doing one of the best jobs we can in the United States of protecting our children. And we thought that was imperative. The next item on the list is tourism across the state. We suggest and recommend that DMOs, which are destination marketing organizations, many of you have them in your area. They say, let's come to Hattiesburg, let's come to Greenville, let's come to Tupelo. Local agencies, locally controlled agencies that showed numbers to us that they received monies from CARES Act, that they did untold great good for Mississippi. While other states were losing their tourism, Mississippi was gaining tourism, and most of it was because of the work of these DMOs. Another thing we looked at were our state parks. As you know, our state parks, many are not in the best of condition. There's always been a need to look at trying to improve those parks. Those parks are a tourism destination. So as you'll see on your report there, we've allocated $32,500,000 to state parks. But look down quickly at number 8E. There you have wildlife again, and you have $22,500,000. What that means is if you put those two together, we're recommending spending $55 million at our state parks. So that's a total we're calling tourism of $62,500,000. The Health Department Central Operations have had many challenges this last couple of 3 years. We recommend to help their operation and help their infrastructure needs. We recommend a spending of $26,750,000. The next big ticket item was our mental health. We all know some of the strains that have been put on families and households during COVID. Mental health issues have arisen more than ever. It's tough. Again, we felt like spending on mental health will do a better job making Mississippi stronger in that area, taking care of the needs of our patients and families who have mental issues in the family. And this money will be well spent to ensure that we can again look at becoming one of the leaders in the nation of how we direct mental health care to our citizens. Also under mental health is a recommendation of $18,550,000 to be spent by what we call mental health czar, Bill Roseman, who is working diligently with our community health services. Good work is being done there. We need to change some things that are being changed, but they've got to have some money to do it with. This gives us an opportunity, again, to be able to right some issues that we need to right in an effort that we've never had before. So our total mental health spending right there is $104 million, but if you will, look down at 8D. You'll see mental health again, and there you will see $65 million. As you know, we have state hospitals and different places that our mentally ill people, patients have to go. We need to make them safe. We need to improve the infrastructure. And that's a big dollar amount that we're wanting a recommendation. We're recommending we spend $65 million on these, the mental health hospitals and other offices and needs. Again, monies that we now have that can be spent with ARPA rules. Next, we need to take care of our law enforcement officers. Many have died. We also have firemen that have died. So we're recommending a $7,500,000 input to cover right now, COVID was not considered one of the death benefits that we could pay. COVID now will be for firemen and policemen, and that will be $100,000 that will be spent that we normally wouldn't spend on a first responder death like that. This will give us the opportunity to fund those. Next, excuse me, our DFA building, Bureau of Building eligible projects. As you see the list there, corrections, $80 million. If you've toured some of our prisons, if you've looked at some of our prisons, listened to our commissioner, you know many are in deplorable condition and need help quickly and badly. We're recommending $80 million for the infrastructure at our prisons. State buildings, again, we have many that are in a bit of disarray, $26,500,000 there. Human Services, $5,150,000, and that is for our Oakley Youth Detention Center. That is a place of basic incarceration, and we need to upgrade the facilities there to ensure that COVID protocol is being able to be done. I went over mental health, I went over welfare, wildlife. Then we look at public safety. We're recommending $11,535,000 for public safety to improve the infrastructure of many of their operations, and also to look at building a new medical examiner's office in the North Mississippi area, where right now we do not have one. After that, it's the State Fire Academy, again, a place where many people are gathered together. They need $750,000 to assist in their infrastructure to improve their COVID protocols. Number 9, we look at our institutions of higher learning. These are for all water and sewer type infrastructure. Community college, and these numbers are numbers that were verified by building of Bureau of Buildings at DFA, and they suggest we do $32,750,000 for community colleges, $68 million for IHL 4-year degree colleges, and then $9,500,000 for the University of Mississippi Medical School, for a total of $110,250,000. Other agencies that we need to look at, Mississippi Emergency Management, spent a lot of money during COVID. Most of what they've got will be reimbursed, but we feel like that $3,170,000 certainly will not, and we're asking that that be we recommend that fund be, those monies be given to Mississippi Emergency Management. Our independent colleges and universities received CARES funds, and they did some good work with those funds. We're suggesting $10 million for the independent colleges and universities. Those funds would be for infrastructure projects, and that would be prorated per student at each one of the colleges and universities. Next, the Mississippi National Guard had infrastructure needs. $10,391,000 is a recommendation for work on some of the infrastructure, primarily at Camp Shelby, which, as you know, Camp Shelby is one of the largest National Guard training camps in America, if not the largest, and we see a lot of people from a lot of areas. That's why we're recommending that. The reimbursement of ICU and negative pressure beds, we have at $12 million. That is a number we recommend. We don't know quite how many ICU beds were created, how many negative pressure beds were created at hospitals. We're still gathering that information, but we wanted $12 million there to help reimburse our hospitals for those units. Mr. Chairman, that's our recommendation.
Thank you, Senator Polk, and as you can tell from his explanation, he and his committee did yeoman's work in compiling all this and going through all the items, all the requests from the agencies, and I know I watched him personally meet with people, and times when the rest of us were home, he was up here or somewhere meeting with the different agencies and groups that had requests and getting to the bottom of it, and you committee members that assisted going through this, I know we're all appreciative. One, I think, correction, Senator Polk, and this is going to be a general bill, so it's not for discussion today. I think on the rural water associations, they will not be, you mentioned the general bill proposal for cities and counties, really cities primarily, will be the one-to-one match on ARPA funds. For rural water, they didn't get direct ARPA funds, so I think the discussion the committee had was that the rural waters would actually be able to match whatever dollars they would come up with. Is that correct? Okay. I want to make sure that was clarified. And I do think that most of the other projects, when you really start looking from 8 down, with the exception of the ones that he mentioned, most of those, or a lot of those, I should say, are water and sewer projects within those agencies and institutions, correct? That's correct. Okay. All right, that's an overview. Before we get to the 4 bills that we're going to discuss individually, do you have any questions for Senator Polk on the overview of the ARPA projects? Senator Wiggins, you're recognized.
It may be a comment, and this developed on the Oakley Youth Development Center. We had a subcommittee meeting this morning, this morning. And we can talk about this, but I would ask the committee to think about it. What was told to us was we have 35 total youth there to a tune of $17 million costing the Department of Human Services. So based on this, $5 million is going to be put into that. I think, I'm not saying we don't need to do COVID, all that. I'm saying I think we need to look at these things because that came out of our subcommittee meeting today. So thanks.
Well, and I'll let Senator Polk address the specific things, Oakley, but keep in mind these funds that come out of ARPA have to be for those 4 categories, broad categories of things. So some of the things you may have heard in the committee meeting were not water and sewer, for instance. They were other concerns I would think that they have at Oakley. But I think the issues, and Senator Polk, you can address this, I think the issues that he's identified or the committee's identified in here for Oakley are the ones that they feel like, or at least some portion qualifies under ARPA.
Okay.
That is
If you could just give those 4 again, please, just run down them. Those 4 categories that the ARPA qualifies for.
ARPA, the 4 broader categories, which I can get you the exact list, but essentially you have the water and sewer. What is that noise?
I don't know.
Water and sewer, the broadband, the health-related issues, and then there's, I call it a catch-all, but it's got some other issues that could be covered under it, and we can get you the exact list.
That's fine. Thanks.
Yep, thank you, Senator Wiggins. Other questions, committee members, before we get to the bill? Senator Norwood, you're recognized.
Thank you, Mr. Chairman. Senator Pope, I think you said that, I don't know if the amount was $250 million that was transferred to the general fund.
We are recommending $250 be transferred to general fund.
And those funds that's transferred to the general fund would lose the identity or lose the intent of what those 4 categories, and once they go into the general fund, so they could be expended for
They will be put in a separate fund. All that happens is some of the restrictions that are on ARPA funds, when you say that it's lost revenue, which it is, and you move it to this holding account for general fund, it opens up more possibilities of spending on issues that we feel like are necessary in Mississippi.
So do we have a definition, will we have a working definition for what would account for lost revenue to make sure that that the funds will be expended on, I guess, relative
The Treasury Department has given us guidelines and gave DOR and DFA work diligently on that. They had a formula that they could use to ensure that the dollars that they're putting on lost revenue are included as Treasury lost revenue.
Okay, now, I guess my second question would be regarding the funds that we're allocating to the specific departments. Now, those funds will take on the same meaning of the 4 categories, or these funds would be used outside of those from the general fund that's,
The sheet that you have here, all these funds, we feel like definitely meet the Treasury guidelines for spending of ARPA funds. And they will be spent on those particular areas. And what they have identified in their request fit those areas. And also you'll see in the bills we're about to present, we go almost overboard ensuring that every agency knows that they've got to follow the ARPA spending guidelines handed out by Treasury.
okay, because I look at the first bill, it says enhanced services to child welfare involved families and foster. Now, do we have a working definition for what that would be inclusive of, or are we leaving up to the discretion of the department?
That's a good question. We are leaving up to discretion. Our committee heard their recommendations of what they want to do, and it all fits the ARPA language, and it all improves child protection.
Okay. Thank you, Mr. Chairman. Thank you, Senator Pope.
Thank you.
Thank you, Senator Norwood. And to further address your question, Senator Norwood, one of the categories is replacing the lost public revenue. And our state's identified, as Senator Polk recognized, some $280 or $290 million. So actually putting this in the general fund is part of what the Treasury regs say you can do. So it's not as though, although Senator Polk is correct in identifying these are dollars we can use for ARPA-related projects, it's actually, this is a category that the funds can go to. Does that make sense? All right, thank you. Senator Butler, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, did you mention that we're talking about a dollar match earlier on these funds?
Are you talking about the water and sewer in 750? Yes, it's a dollar for dollar match of ARPA funds to the cities and counties. Water associations, of course, did not get ARPA funds, and they will be able to come up with funds on their own that we will match. And there will be a limit of what our match would be on the total project.
Okay, was there discussion about towns not able to do the dollar for dollar, that maybe receive ARPA funds, they're not able to match, but they still have those projects?
They will be able to fund them through bonding or other ways they can raise the funds to finish the project.
I mean, how, I mean, when these towns don't have the money, so how do you just go raise money, all of a sudden they can just raise money to finish their project?
That certainly was a discussion. That's why, as you'll see, we knew that some of our smaller communities certainly would suffer. And that's why we've added that $50 million bucket to ensure that in those situations, we can match a bigger amount for those small communities that got less than $1 million in ARPA funds.
Okay, so that would be the monies that's used to help with the match for the towns that's got less than $1 million?
That's correct.
Thank you, Mr. Chairman.
Thank you.
Thank you, Senator Butler. Are there other questions? Senator Turner Ford.
Thank you, Mr. Chairman. The sums that are allocated for tourism, specifically tourism at destination marketing organizations, are these based on losses that were realized, or is this to plus up the organization of this fund here?
It is to plus up tourism in Mississippi. And tourism has now become the 4th largest industry in our state, employing many, many people. And we felt like some of the best money we got, return on investment during the CARES Act funding, was in our tourism. And every dollar you bring in from outside Mississippi is just gigantically multiplied when we're able to get the foreigners' money in here and spend it. So we plussed up tourism to ensure we could do our very best to increase tourism.
And is that the same premise for, I guess, the wildlife projects? That's for their buildings? Is that?
It's for buildings, it's for improvements to their water and sewer, and it's also, as you know, RVing has become very large, especially during COVID, and this is to improve the pads and facilities for those too.
So is it fair to say that the tourism industry in the state of Mississippi did not suffer a loss due to COVID?
I think tourism did, especially the restaurants in Mississippi. Many were shut down. But we want to make sure that what we have got and started and spent money on will be able to be parlayed into much, much more for our state.
Will the restaurants be able to access this fund?
They will access it only because the DMOs will be advertising, bringing more tourists to that restaurant to spend money that they didn't get 2 years ago.
Thank you.
Thank you, Senator Ford. Also, the state parks are eligible specifically under the ARPA, so that is one category that was specifically mentioned for use of ARPA funds. Senator Tate, you're recognized.
Thank you, Mr. Chairman. Thank you, Chairman Polk, for all your work on this. Just a question here on 1A, when it says we're cities and counties, we're going to do $350 million to them. If every city and county decided to go to water and sewer with their ARPA funds, do we know about what percentage we're able to match?
I can tell you this, the cities, we had two categories of cities, large cities and our smaller towns. Large cities got $101 million directly from ARPA. Non-entitled units, which are our small towns, got $268,046,000 in direct ARPA funds. So that's why you see the number of $350 million. Very seldomly does a county have any infrastructure of water and sewer. So we feel like $350 million with the $50 million extra bucket would certainly cover the amount of ARPA funds that went to the cities and towns.
Good, thank you.
Thank you, Senator Tate. Senator Branning, you recognized.
Thank you, Mr. Chairman. I want to echo the sentiment of the committee and tell Senator Polk how much I appreciate the work on this, this very big project. With regard to the water and sewer projects on the city and county level, I understand there's going to be a dollar-for-dollar match, but is it the intent of the committee that those specific projects be presented for award at the state level, or will that money be pushed to the counties for them to decide what particular projects will be worked on?
We are still working diligently. We assume that our state agencies will handle the disbursement of these funds, and it will go directly to a city, let's say, for what they've done. But one caveat that we have made sure of is that we will not pay in the beginning. We will only pay what I call in arrears. After the work is done, the state will reimburse the city for the work that they have done on a particular project. But it will not go to the counties. It will be handled at the state level.
So there will be maybe an application process
Yes,
at the
and
state level with information about different projects that the locals desire to work on?
They will be asked to turn in. In fact, I believe the Lieutenant Governor has been an office that has been collecting projects already.
Okay.
To try to get, and we will move those to whatever agency we actually finally determine will handle the disbursement.
Okay. Thank you so much.
Thank you, Senator Branning. Other questions? Senator Norwood.
Mr. Chairman, this is one that I had on my notes and overlooked. Senator Pope, now looking at the departments that we're awarding or proposed awarding these funds to, do we know or did we get an explanation in terms of whether they were funded, some of those were funded directly with CARES Act funds? And if so, and I know most of them receive some federal funds, are they expending those funds that they've already been awarded to the point that it is determined that additional funds are needed?
We feel like that these recommendations are what these agencies need. Water and sewer funds have to be spent on water sewer at whatever agency or even in the county and city.
Oh, okay, I mean, I'm satisfied with that. But I'm
Okay.
talking about from the general standpoint, the Department of Health, Child Protective Services, mental health, whether they receive direct funding, CARES Act funds, to carry out functions. If they receive those funds, have they expended, are they expending all of those dollars that have been awarded to them?
I cannot answer that question, but give me 1 minute. Okay, okay. But they could use it, Child Protection Services. I'm advised that these Child Protection Service and mental health did not receive large amounts of CARES funds. This will prompt them up to be able to finish the projects they need to do.
Okay, and Mr. Chairman, just for an explanation, my only concern is that they do not send back to the federal government funds that they've already been awarded that could be used for meaningful projects and purposes, and then we're giving them additional money, and they in turn don't fail to expend those dollars. The dollars are available, expend the dollars to provide those services.
I understand what you're saying, and I will say this. What we're recommending is tremendously lower than their request. So I can assure you every dollar that we're recommending to be spent will be spent, and they need many, many more than what we're recommending.
Okay, Mr. Chairman, I guess I have a sidebar on that because I still think that we need to be provided some type of assurances that if we're going to obligate these monies to these agencies to make sure that they have meaningful projects that they can expend the dollars on. Otherwise, that's dollars that we could make available to other entities or organizations that could just to make sure that the money is expended according to the policy.
Senator Norwood, all of the projects that you see here on this list, they've all had, in addition to hearings that the committee had with them, we've had LVO and staff looking into, and a lot of these things, frankly, some of these projects that have been requested to us as a legislature over the last year or years even for some of the things that were desperately needed for their agency, but we just haven't had the funds to get those to them. And now we've got ARP funds that could be available to take care of those one-time basis. You know, there's some things, and there's some that you have, and let me say, some of the agencies, like if you talk about CPS or mental health, maybe a couple of health departments, some of those, you know, the health department's been needing some of this stuff for years. Mental health, I mean, these things on their list, they've got the 988 call center, they've got crisis beds and crisis service center, things that they've been asking for and that we've been trying to inch our way along to get to, but suddenly this is going to get a chance to put some of these problems they've had, if you want to call it that, to rest for good, hopefully. I mean, some will require, and this is the tough thing, there'll be some agencies that get funds here, and because of some of the things we've done here, unfortunately, there will be a handful that have some additional recurring cost because, for instance, in mental health, we're going to be adding some crisis beds in here. Well, that's going to require some additional maintenance, and I have talked, Senator Polk and I talked with them about, all right, as we do some of these other things, you need to be looking at ways that you can reduce, if this is the focus of your department, some of the ways you can reduce some of those other costs, because I don't want to just throw, you know, we've got something new coming here. I don't want to keep throwing money over here at something that you don't need anymore, just to say you got it. And I think that's the discussion that's going to continue on for several years, because some of these as Senator Polk said at the beginning, some of these don't even have to be expended until the end of '26. So we've got, 4 or 5 years before some of this is we're really going to know what the effects are. But I get your point. I think it's a very valid point, Senator Norwood, about making sure we're not duplicating or we're not losing funds elsewhere. And things like, by the way, things like CARES Act, some of these agencies got little or no money out of the CARES Act. So I don't think a lot of these you probably shouldn't even be concerned about, because there's really nothing there for them that overlaps with this. But your concerns are well noted, and I know staff and all of us ought to be looking to make sure we're not losing those opportunities or funds in other ways.
Thank you. Thank you, Mr. Chairman. Thank you, Senator Polk, for your explanation.
Thank you, Senator Norwood. Other questions before we move to the bills? If not, Senator Polk, you're recognized on 2862.
Thank you, Mr. President, Mr. Chairman. First bill that you'll be looking at is our Child Protection Services bill that expends the funds, if you approve this, as we suggested earlier, $59,100,000 for the purpose to have our child welfare-involved families and foster youth that were negatively impacted by the coronavirus pandemic and other operational expenses as allowed under the ARPA rules. If you will look at Section 2, it's very clear that none of these funds can be used for premium payments to employees. If you will look at Section 3, a lot of this becomes boilerplate language to ensure that our agencies spend the money in the correct way, which is the Treasury rules that have been issued by the ARPA, under the ARPA law. If you will look at line 71, 72, 73, if they misspend the funds, they've got to pay it back to the state of Mississippi, so we can pay it back to the federal government if it's required and requested. Section 5 says the treasurer of the state of Mississippi, where the fund monies will be kept, will be issued and have to issue the $59,100,000 as is needed. Mr. Chairman, if there are no questions, I move for passage.
Thank you. Any questions about that specific bill? Senator Turner Ford, you're recognized.
Thank you, Mr. Chairman. Are we going to, so this bill would authorize Child Protective Services to formulate the program that these families would, I guess, some sort of application process for the, let's see, what are they referred to as child welfare involved families and foster youth to access?
Child Protection Services will be in charge of the funds to spend in the proper ways, as I just mentioned, for the betterment of the child protective service. Some of the things mentioned are a safe reduction in caseloads. As we know, so many of our children and of our caseworkers are having triple the number of cases they should be handling. It also increases the ability to move adoptions faster. We're going to spend $1.1 million for 4 years, according to CPS, to get adoptions through. Many of our foster parents have children that they want to adopt, and because of COVID and the court system, it's all backlogged and jammed up. We want to see that move forward. Another is a tiered rate structure to promote more appropriate placements for children in foster care. We're going to allow $6.3 million for 4 years there. Now, that's what they've requested. That's what they've told us they're going to do with many of these funds, and that's why we're requesting this $59,100,000.
Would these funds allow Child Protective Services to hire additional employees?
Yes.
And so what about the budget process for the agency? How is that going to be approved?
Mr. Chairman.
Same as always.
Well, I guess will we be in a position?
Yeah, things that might otherwise be covered by this certainly would not be included in their general appropriation.
Thank you.
Thank you, Senator Ford. Other questions?
Title sufficient.
Yeah, no other questions. The motion was title sufficient to pass. All in favor, say aye. Opposed, nay. The ayes have it. Senator Polk, you're recognized for Senate Bill 2863.
This is the MEMA bill, same basic structure of the bill. If you look at it, we're requesting $3,170,000 for funds appropriated to be able to be used by MEMA to reimburse, get reimbursement for the items that we don't think will be able to be reimbursed by the FEMA. And again, the same boilerplate language that ensures they spend it correctly, that no premium pay can be paid with the funds, and that if there is a snafu and federal government comes back and says you owe us money, they have to repay it, and it goes into effect on passage. Mr. Chairman, no questions, title sufficient to pass.
Any questions? Hearing none, the motion is title sufficient to pass. All in favor, say aye.
Aye.
Opposed, nay. The ayes have it. That bill will be reported. Next bill is Senate Bill 2864. Senator Polk, you're recognized.
Thank you, Mr. Chairman. 2864 is our National Guard bill. We're requesting $10,391,000 for the Mississippi National Guard owned facilities and buildings to improve their infrastructure. As you can see, again, the same boilerplate language. Anything that is done at the National Guard regarding water and sewer have to meet the national programs for water and sewer and the way that passes all their regulations. No money for premium pay. If the money is misspent, it has to be paid back. Good upon passage. Mr. Chairman, if there's no questions, title sufficient to pass.
Thank you. Any questions? Hearing none, the motion is title sufficient to pass. All in favor, say aye. Aye. Opposed, nay. The ayes have it. That bill will be reported. Senator Polk, you recognized for Senate Bill 2865.
2865 is our mental health request. As you can see there, it's the same as we asked for, $86,069,500 for mental health services. Some of the items that you might be interested in, I think we need to point out, is I did not know this, many of you may know this, but we have a new project demanded by the federal government called 988. 988 is going to be the new 911 for mental health. In other words, if you have a family member or issue at your home with a mental issue, you don't call 911, you'll call 988, and they will respond, and they will do what's necessary. That's going to be a little bit of an expensive program, and what we're suggesting to do is to pay for 4 years $2.5 million. There are other items on here, mobile crisis teams, crisis services, mental health first aid to public safety training to ensure that our first responders know how to handle situations. We have CIT for law enforcement, adolescent offender program, adding a program at each one of the 13 CMHCs, and a myriad of other things to be able to spend the $86 million. Then if you move to I'm sorry, got the wrong bill. Here it is. If you'll move to line 27, there we're requesting the $18,500,000 for the Community Health Center program under our quote czar to be able to increase and improve theirs. Primarily, the expenditure there will be for a new computer software system to ensure that all of our 13 districts talk to each other. Same boilerplate, no money for premium pay, and the usual payback if something happens. And it's good upon passage also. If there are no questions, title sufficient to pass.
Thank you. Senator Norwood, you recognized for a question.
Mr. President, I'm sorry, Mr. Chairman and Senator Pope, the state hospital, the beds, were you referencing beds for state hospital in that, or are they included in this?
What we do have are 60 more crisis services beds that'll cost us $7.3 million for 4 years. We're going to add beds to that situation.
Thank you, Mr. Chairman.
Thank you, Senator Norwood. I would point out before we make the motion on this final bill that all 4 bills, keep in mind that we're receiving the ARPA funds in 2 tranches. We've already received $900 million. The remaining $900 million is supposed to come out roughly a year from the first tranche, which was May of last year, 2021. So the bills that we've got before you are well below, the cumulative number is well below the $900 million that we've got. The rest of the funds, we will have some of the bills later in the session, especially those who deal with the general bill language that we have to put to be expended at some point after we receive the additional funds. I don't know, we'll talk about that, maybe July 1, but maybe effective immediately upon receipt, but we'll cross that bridge when we get there. But these will be, as Senator Polk has recognized, payable effective upon passage. Obviously, we've got to get through the Senate and the House and get them done before any monies can be expended, but just wanted y'all to be aware of that. The motion, Senator, you thought it was sufficient to pass. Any more questions about it? If not, all in favor say aye. Aye. Opposed, nay. The ayes have it. That bill will be reported. Any other questions for the good of the committee? If not, the motion is to rise and report. All in favor say aye. Aye. Opposed, nay. The ayes have it. Thank you very much.